really exciting when I got the call saying I had won this award. It means an immense amount for myself and our research around homelessness and health. It's an area of research that it's hard to attract the research dollars. It's hard to, I guess, necessarily find mentors or pathways to pursue that kind of research in Australia. And so it was really amazing to get acknowledgement of our research for myself and my team. And I guess a validation of our efforts to get outside of the ivory tower and do research that's really grounded in a complex social issue and how can we use evidence and data to address that. Homelessness is a massive issue in Australia, and we saw that in the census results that showed that we had over 110,000 people in Australia homeless on the last census night. And homelessness presents a huge burden for the health system. We have many people who are homeless who attend ED, they stay in hospital, they exit a hospital back to homelessness, and it's just a revolving door. The challenges in doing research around homelessness is that it's really hard to access the population and to get robust data. And we found a way around that by accessing linked data from the health system, hospital data, we have homelessness service data, and we most recently have police data, all obtained ethically, of course, but linking that data in a de-identified way to look at both the predictors of homelessness and the interventions and effectiveness. And we have a sample of 3,400 people with hospital and police and homelessness data, which provides a really rich picture of what are the needs of homeless people and how well are we addressing those. For me, the honour of getting the Sax Award is the recognition that research that makes a difference to policy and practice is acknowledged by the field. We've had some really fantastic examples of this. One example just last year was a street health service that was providing healthcare to rough sleepers was about to close because they had no funding. And I said, you can't have that. So we quickly generated some case studies and a short, pithy report that showed the benefits of that service. It got some media coverage, and it led to a philanthropist from over east coming forward and offering $100,000 to continue that service. She's just put in another $100,000, and one of her comments back to Homeless Healthcare was how much she valued the evaluation that was being undertaken of that service. Foremost, I'd like to thank the people who are homeless who I've had the privilege of interviewing and talking to over the years, because that's immensely humbling for me, and it reminds me that this is worth persisting in. I also really thank my team. We haven't had big research dollars, so I've relied a lot on students, work experience students, colleagues generously giving their time to assist with our research, and it's been a really fantastic thing in our school to have more and more people come on board and support that